Our legal department is going to lead us through a lot of the agenda today, so I'm going to hand her. But for our friends who are online, I'm not going to be in frame mostly, but are you? I want to make sure that you heard. Great. So thank you, all of you, for coming, and thank you for coming on Friday afternoon. I know that this is a top priority for all of us, and it's so wonderful that everybody's been able to attend either in person or virtually.
Oh, thank you, Director. Thank you. Good afternoon, everyone, and welcome to the meeting. I'm Lisa Musowitz, as Director Chris said. I'm one of the attorneys at BOMAS. And again, we are really grateful to have you be a part of this work group. Before Director Chris gets our meeting underway, I'd just like to review a few housekeeping items to ensure that not only you can hear everything, but also our virtual participants, as well as members of the public who are also maybe listening in virtually. So the work group members here, if you could, as Director Chris asked, if you could just mute your laptop speaker and also your Teams audio. That way that will prevent some feedback. And then work group members that are attending virtually via Teams, please make sure that your computer audio is turned on and that your Teams mute unmute function is also that you mute yourself until we authorize that for the member introduction period. Members of the public and the media who are joining virtually, please just make sure your audio is turned on to hear the recording. And if you have any difficulty joining virtually, you may dial in by phone. That phone number is listed on the slide there, 614-721-2972, and there's the passcode up there as well. It's 7534-13883#. If you are a member of the media, please put your name and organization in the chat box. Thank you so much. So all of our public participants will be in listen-only mode today. However, at the very end, there will be a public comment period where members of the public can enter comments or questions in the chat box or send us an email through the work group's email address, which is 340reviewworkgroup@mha.ohio.gov. Closed captioning is also available for the Teams participants, and to access that, you would go to Turn Live Captions On function, which is the ellipses icon in the top right-hand corner of your screen. So with that, the next slide, Angelica. So this is our agenda for today. It is the agenda that you received in advance. At this time, then, it is my pleasure to direct you to Director Lori Chris.
Thank you. Lisa, for the time in helping us get ready for today, and I want to acknowledge you for that. But also acknowledge the other partners who are here with us today, and Director Alicia Clark and moderation. Director Amy Chadwick, not with our department, but with the governor's office. Then also Lisa Frederick from our chief legal director. There's Nicole runs the Department of who I know all of you have had the pleasure of interacting with, and Jonathan Baker. Yeah. And then also thank Dan for being here with us today from our IS team, getting us set up for today. So yes, for the work we've had.
We had a comment to speak up a little.
Yeah, okay.
Thank you.
Sure. And so, is this better?
Maybe we should try a microphone.
You step closer to the mic.
Oh, it's close to my.
Also up here, somebody. Okay, so, I appreciate DPS's willingness to collaborate and host us because of the, free parking, right? So you don't have to navigate downtown. Navigating getting into the Rhodes Tower right now is a bit tricky as well. And so we'll be using this space, with their generous support, and we really appreciate this. And so, with that, I want to kind of add a couple of other things just before we jump into the agenda fully. Today is significant, and I want to thank each of you for your commitment to being here for this conversation. It's certainly one that's been a long time coming, and it's part of a series of conversations that we're going to need to have, right? We know that there's been this request to talk about 340, this section of the revised code specifically, but there's also interest in talking about 5119 and 5122, the other parts of the code that are really govern how we operate as a behavioral health system. And to do all of that at once would be really overwhelming. 340 is a spot that we know there's been a lot of interest and a lot of conflict, frankly. And so diving into this work and having this conversation is a good starting point, but it's certainly not the end point of where we are. All of you are here. We really wanted diverse representation from around the state, from different experiences in planning and providing and being the voice for families, people with lived experience, and having this opportunity to really be together and to spend this time in being creative and identifying challenges and creating opportunities for solutions together. So, I'm good. Okay. Move to the side. Okay. Everybody rehearsed but me. So I think we learned a big lesson here. We'll know that for next time. At the center of this work are the faces and voices in front of us. And this is important for us to stay centered in remembering that listening to the needs of Ohioans and acting with urgency is what Governor DeWine has asked me to do as a cabinet member. That was our first charge in our first cabinet meeting. It's what we try to, the bar we live up to every day at the department. And so having all of us here today really focused on what's best for children, youth, families, men and women in Ohio is top priority. And Presha, we had this conversation when we were together a couple of weeks ago about how, you know, when we keep the people in focus, it helps us do our best work. And so this is really where we're, you know, driving and organizing this work from. And we know that we really do want to hear from the combined experiences that all of you have and the input that all of you have to have this strong foundation for our system. And looking at our mission and goals here, we really came together around, we're coming together around this idea to identify those challenges that we're experiencing with the current governing structure in section 340. And as I said, this is a long time coming. This is not a new issue. And there have been historical challenges, conflicts, even lawsuits about some parts of 340. And it's important for us to know that and acknowledge that. There are some current realities that are just making it difficult to live with 340 as it's written today instead of how it was originally conceived decades ago. And so this is an opportunity for us to come together to identify those sections of the code that warrant review from the group, to define the challenges that keep us from really doing our best work as a system, and to explore potential solutions together. And so in doing this, it's going to require some creativity and some innovation and some imagination. I don't know, can all of you see this slide here? You can see it on your laptops too, right? Okay. I really like this quote. Really, you know, if we stay focused on the narrow band of familiar options that we've gotten used to thinking are the only way, next step on the path forward, that's going to limit us. And it reminds me a lot of the recovery principle of if we always do what we've always done, we'll always get what we always got, right? Or if nothing changes, nothing changes. And so these are places for us to really kind of settle into as we start into these conversations. I will say that that means that it's going to be uncomfortable. Just flat out, it's going to be uncomfortable, right? The grown zone, that's where growth happens. That's where change happens. And who loves that, right? So that's an important part of what we're talking about over the next several meetings together. If this could be done adequately through just a quick analysis and some data points, it would have been done already. But that's not the case. This really calls for the cultivation of collective wisdom. That's what we're doing with this group that's assembled here today, with public comment, and then with the regional meetings that we'll be having as well. Our goal is really to generate ideas, and I want to emphasize that because we have other work groups happening at the department. Alicia is leading the crisis task force. We have other work throughout our bureaus that are really engaged with community partners, and those are driving towards, you know, consensus and recommendations and paths forward. This one is meant to generate ideas and to document all of those ideas. So this is really not to force consensus on recommendations, but to ensure that we get all of the perspectives on the table, and that we then use that in a report of recommendations that are geared towards all of the possible solutions. So this report will document challenges and document what's come forward from this committee work. And we really want to make sure that the public concerns and aspirations around 340 and around the behavioral health system are consistently understood and considered before moving into rewriting law, you know, statute that will affect Ohioans for years to come. And so this is this is an important slide that I hope all of us spend some time thinking about. I'm gonna also just point to our values. These are values that I set with our leadership team as I came into this responsibility as director. And this is the bar that we reach for every day in our work with each other and in our work with all of you. I'm asking each of us to enter these conversations with mutual purpose and mutual respect. I have immense respect for all of you and your colleagues and the constituents that you represent. And I know that we all want what's best for Ohioans. We've been through a lot together over the past 2 years, particularly with the pandemic. And I've been so struck with how what could have been a time of a lot of competition really was a time of great collaboration. And so this is one more time for us to be called upon for that mutual purpose and mutual respect. I am grateful, again, that each of you are willing to enter into this conversation, to contribute from your perspective, and to, you know, not be afraid to ask a question, to seek clarification, to say the things that you won't get kicked under the table for saying, Tony. That this is the time for it, right? It's not the time to have the conversation after the meeting. It's the time to have it in this room. Let's get it all out and figure out the best path forward. My role is to facilitate, and our role as department staff is to listen, and then we'll take it back and analyze and be putting documents together for you to review with you. But my role is as facilitator to ensure that all voices are heard and to keep us focused on what's best for Ohioans, and that's what my intention is here. And so please let me know how I can serve you better in that role as we move forward too. And so now, want to take some time to do member introductions of all the folks in this room. We have a large work group, so we'll do our best to keep this brief so we can move into the meat and the potatoes of the agenda. And we have time later on the agenda for discussion, questions, answers, and that's where we'll dive deeper into some of those things. I did not bring you all here to sit quietly for 2 hours, I promise. But this is a good opportunity for us just to know who's here, where you're from, and who you serve, and just to kind of move quickly through that. So we're going to do this in order of the member list that's in front of you and that was emailed to our participants who are joining virtually. We will start with Jamal, your first on the list, and then we'll move to Tracy. And If you're joining virtually, just unmute your mic when your name's next. And if you're in person, make sure to speak loudly towards the middle of the room here so that everyone can hear you. So I'll start with Jamal.
Sure. Good afternoon, everyone. Jamal Boyd, Senior, CEO of the Parker Center located in Cincinnati, Ohio. We serve Hamilton County.
Tracy Campbell, I'm the Operations Director for Violence Counseling and Recovery Services. We serve Erie, here in Ottawa, Sandusky, Seneca, Wyandotte, and Lorraine.
My name is Tony Coder. I'm the Executive Director of the Ohio Suicide Prevention Foundation. We're a statewide nonprofit focused on reducing suicide. And we also serve folks who have lost loved ones to suicide with our family advocates for suicide. Thank you.
I don't actually have the list, so I'm going to need someone else to prompt it.
Sure. So our next person is Lavelle Custard.
Oh, is Lavelle online? Yeah.
Good afternoon, everyone. My name is Lavelle Custard. I'm the CEO of Murders Taylor Human Services, and we are a comprehensive behavioral health agency in Cuyahoga County.
And then we have Bobby Douglas.
Bobby with us online?
Sorry, I had trouble getting it unmuted.
Here?
My name is Bobby Douglas, and I'm the director of 180, which serves Wayne and Holmes County. We provide services that deal with substance use disorders, mental health disorders, victim services, and also serve with homeless and housing services.
And then next we have Joan England.
Hi, everybody. I'm Joan England. I'm the Executive Director of the Mental Health and Addiction Advocacy Coalition. We're a statewide policy and advocacy organization with a wildly diverse membership who all see the impact of untreated disorders every single day from their unique vantage points. Look forward to the opportunity to work with all of you.
Thank you. And then next we have Danielle Gray.
Danielle Gray, Executive Director for Ohio Recovery Housing. We're a statewide organization with a mission to increase access to quality recovery housing options for people with substance use.
Thank you. And now we have Robin Harris.
I'm Robin Harris, Executive Director of the Adam H. Board for Gallia, Jackson, and Meigs counties.
Thank you. And then next we have Tracy Maxwell Hurd.
Good afternoon, everyone. Tracy Maxwell Hurd. I'm the Executive Director of MAC, Multi-Ethnic Advocates for Cultural Competence. And we do cultural competence, implicit bias, racial equity training throughout the state of Ohio for behavioral health practitioners, education, criminal justice. It just keeps expanding every day. Glad to be with you guys today.
Thank you. Next is Helen Jones Kelly.
Good afternoon, everyone. Helen Jones Kelly here from the Adamus Board in Montgomery County. We serve 537,000 residents of our community, and we have great partnerships with our collaborative adjacent communities as well. So glad to be part of this as well.
Thank you. Next we have Michael Kraus.
Good afternoon, everyone. Michael Kraus. I'm the Director of Ohio Peer Recovery Organizations. Ohio Pro is an advocacy organization who advocates for peer-run organizations and peer support services across the state for individuals in recovery from a mental illness or substance use disorder. Thank you.
Thank you. Next we have Teresa Lample.
Good afternoon, Teresa Lample, CEO of the Ohio Council of Behavioral Health and Family Services Providers. I'm sure I get the word with the longest name. Really start there. But we represent 160 of Ohio's community mental health centers, addiction treatment providers, range of care services, and to support all the Ohioans that need a behavioral
Thank you. Next, we have Sarah LaTourette. Is she joining virtually?
I am. I'm virtually. Hi, everybody. Sarah Laturette. I'm the Chief Advocacy Officer with the Ohio Children's Alliance, and we're a statewide organization made up of children's behavioral health and child welfare agencies.
Thank you. Next, we have Marisa Weitzel, but I think she maybe she may be attending virtually.
I am. Hi, this is Marissa Weisel, Deputy Director of Strategic Initiatives at the Ohio Department of Medicaid. I'm standing in today for my colleague Lynn Lyon, who will typically be at your group. She's our Deputy Director of Behavioral Health Policy. As many of you know, Medicaid serves about 3.3 million people right now across the state of Ohio. Over 25% of the people who we serve have mental health and substance use disorders and challenges that we hopefully help them combat by providing insurance for the services that they need.
Thank you. Next, we have Dustin Metz.
Good afternoon, Dustin Metz. I'm the CEO of CompDrug. You may know us as Youth to Youth, one of our programs that's nationally known. We are probably, under the CompDrug name, more known for our OTP services here in Franklin County, and glad to be here today.
Thank you. Next, we have Jeff O'Neill.
Yeah, hi, I'm Jeff O'Neill, President and CEO for Greater Cincinnati Behavioral Health Services. We're providing comprehensive behavioral health services mainly in Hamilton and Claremont counties. Good to be with everyone.
Thank you, Jeff. Next, we have Molly O'Neill.
Hi, everybody. I'm Molly O'Neill. I'm the CEO of OCAR, Ohio Citizen Advocates for Addiction Recovery. We are an advocacy organization that should be the voice of people in recovery process that have an experience every time.
Thank you. And then next we have Amy Price.
Good afternoon. My name is Amy Price. I'm the Associate Advocacy Director for Disability Rights Ohio. I also lead our abuse and neglect team and oversee our PAMI grants. And we are a statewide nonprofit organization serving all Ohioans with disabilities in terms of their legal, civil, and human rights education and protection. So thank you for the opportunity to be with this group today.
Great, thank you. And then we have Dwayne Pissarelli.
Hi, I'm Dwayne Pissarelli. I'm the Executive Director of the County Mental Health Recovery Board. I heard the spirit walking on Friday. I groaned, but I'm actually happy I'm here. And it's nice to see people, not just on Zoom. So, you know, all have bodies.
And I just learned how to say your name correctly.
Picciarelli.
Picciarelli. I'm so sorry. I got to put the check there. I got it. Thanks, Dwayne.
Thank you. Next we have Terry Russell.
Hi, I'm Terry Russell, Director of the National Alliance on Mental Illness Ohio, NAMI Ohio, representing those living with mental illness and their families from all over the state of Ohio.
Great, thank you, Terry. Next we have Amy Shadwick.
Hi, everybody. I'm Amy Shadwick, the Director of the Governor's Recovery Ohio Initiative. And of course, we aspire to serve all Ohioans.
Thank you, Amy. Next we have Samantha Schaefer.
Hi, everyone. I'm Sam Schaefer. I'm the CEO of Integrated Services for Behavioral Health. We are a home-based community behavioral health organization. We also do affordable housing and permanent supportive housing development. And with the addition of Ohio Rise care management entities, we now serve 19 counties in central and southeast Ohio.
Thank you. Next we have Kay Spurgel.
Good afternoon, everybody. My name is Kay Spurgel. I am the Executive Director of the Mental Health and Recovery Board for Licking and Knox Counties, and we serve Licking and Knox County. It's
Thank you. Next we have Tom Stuber.
Hi, Tom Stuber. I am President of Woody, Maine, Erie, Medina, and I'm also President of the Ohio Alliance Recovery Provider for the addiction treatment prevention providers.
Great, thank you. Next we have Precious Doobie.
Good afternoon. I'm Precious Doobie from Hancock County, which is
Next, we have Cheryl Subler.
Hi, I'm Cheryl Lepler, Executive Director of the County Commissioners Association. We are a statewide nonprofit organization that works with all 86 counties boards of commissioners, as well as Cuyahoga County and Summit County, who have county executives and a county council. Really happy to be part of this group.
Thanks, Cheryl. Next, we have Patrick Tribby.
Yes, Patrick Tribby. I'm President and CEO of the Hamilton County Mental Health and Recovery Services Board. Prior to this was at a kind of multi-county rural board, so I bring a fair bit of history to the situation, entering my 37th year as a board director, and maybe that puts me in a historian role with Terry Russell, who has a few more years in terms of the system on me. I know he's a young man, but other than that, I look forward to trying to talk about some of the issues that have been there for a long time and hopefully find some solutions on some of those.
Great, thank you. Next, we have Amy Wade.
Hi, thank you. I'm Amy Wade, Executive Director of the Summit County Advocacy Board located in Ohio, and we serve 500 residents.
Thank you. And then last, we have Sherry Walter.
Well, left, okay. It's good to see you all. I'm Sherry Walter, and I'm the CEO of the Ohio Association of County Behavioral Health Authorities, and we represent 49 across the state. This opportunity. Thank you.
All right, well, that was efficient. Awesome. So we're gonna just keep moving through the agenda. Next, we wanted to walk through the work group charter. And our goal here is really to have just an opportunity to kind of lay out today. Our agenda is really focused on laying out why we're together, what we'll be talking about, how we'll be approaching the work, and then have that opportunity for some more discussion towards the end of the conversation. But Lisa's going to lead us through that, and I'm going to sit down.
Sounds good. Thank you so much, Director, and thank you. It was nice hearing all the introductions. So right now, I would just like to pull out some key points from that work group charter. I'm not going to read through all of it. The work group charter is also available on our dedicated website. So in terms of the meeting format, it is our intention to have a largely discussion-based collegial and open environment format. There may be times where we feel it would be beneficial to have a speaker give some background on a particular topic. And so to the extent we think that would be beneficial, we would be inviting individuals to do that. But again, we see this as really kind of a large, a collegial open environment discussion format of the meetings. In terms of meeting preparation, we really want you to come to each of the meetings prepared to dive into the particular sections of Chapter 340 that we're going to be discussing that day. You will receive an agenda before the meeting to know which sections we will be looking at that day. And we would like you to beforehand kind of do some homework and decide, what within those sections are really challenging for your organization or constituency, and also think about potential strategies that might help to alleviate those challenges. In terms of attendance, you may participate virtually or in person. That's up to you. We know, some of you are driving in from longer distances, so we totally understand that. We just ask that you do not send a substitute. Slide. So now I would like to turn it back over to Director Chris to go over some of the ground rules for the work group.
Thank you. Wow. That's all I'm gonna say. The meeting is better than my technology capability. So the work group charter and the ground rules that we put out in the letter, I mentioned this before in my opening remarks, some of the conversations that we're gonna be having, some of the topics specifically as we dive into this are pretty high stakes, high emotion. Maybe not for everybody around the table, and there might be different ones that are different, thought of differently in that way, but I really am confident that we can navigate these well together. And that we will do so with candor and kindness. That is gotta be our top goal, right? So put that authentic need and conversation out on the table and do so with respect for one another. The other thing that I really want us to stay focused on is being as efficient as possible in our comments. Anytime there's a topic that's important, that has, passionate approaches attached to it, and has been a long time in coming, we're gonna wanna have real conversations, but I want everybody to be able to get their point onto the table. And that's gonna take each of us being really attentive to that efficiency in our own comments. And so I'll be managing that, and I will do my best to do that, and I ask you to help me successful in that task. How's that? So I'm gonna hand it back to Lisa.
Sure. Thanks again, Director. So work group members, as I mentioned, will be receiving the meeting agendas in advance, and they will also be made available to the public on our website. And we will also make announcements of the meetings through the department's electronic newsletter, which is called News Now. And then all meeting materials will be posted on our dedicated website. Public participation in the meetings is encouraged. It will be through listen-only mode, which can be done through the Teams link or the phone number. At the end of each meeting, though, we will give an opportunity for public comment. And how we're going to handle that is we're going to ask members of the public to type in their questions or comments through the chat box, or alternatively to send an email to the 340 review email address that's printed up on the slide there. Actually, I'm sorry, I should say it because that's the website, but the actual email is 340 review workgroup at mha.ohio.gov. And then at the director's discretion, we may decide to form some subcommittees to look into maybe some further discussion on topics that might need those. And if she would decide to do those, she would be choosing those members. So our next slide looks at our meeting schedule that's now through June. As you see, today is our introductory meeting. And following the meeting, you will be receiving a survey by email. I'll get into the survey in a little bit. And then our next meeting will be Wednesday, April 6th from 10 a.m. to noon. As of now, we're planning on having it at the same site. The topics that we'll discuss at that meeting are still to be determined, but the survey that you will all be filling out will help us determine what should be on that agenda. Likewise, we will do that same type of format for the May 18th meeting. And then on Wednesday, June 22nd, we are planning to have a public comment opportunity session. And I was going to let Director Chris maybe give a comment about her vision for that.
So one of the things we have built into each meeting agenda is some brief time at the end for public comment or questions, and to make sure that the people who are interested in this work outside of this work group have a full opportunity to submit written or verbal comment or ask questions and get them, heard in a longer time period. We're adding this session here on June 22nd. The intention really is, again, for the department to listen and to document what those comments are, it will be available to all of you as work group members. If you want to participate in that, it's not something that is expected, but certainly, of course, would be welcoming to have.
Thank you. And then lastly, we'll have a meeting on June 30th that will again be similar to the format for our next two meetings in May, or April and May. Okay, and then next slide. And then looking ahead for July and August, we may add some more meetings depending on the materials that we get through here in April, May, and June. And whether we also feel that if we feel more discussion is then needed. And then in the fall, we are planning to have 5 public listening sessions in each of the regional psychiatric hospital catchment areas outside of Central Ohio. And I'll let also Director Chris address those sessions.
So the vision for these sessions is twofold. One, we want to be able to spend time in the community, really giving people who aren't able to participate either virtually or in person during these work group meetings as part of the public that's joining us, to be able to have that opportunity in person to spend some time. Part of the session will be about 340, but really those sessions are intended to be just a broader conversation with members of the general public about their experience with the behavioral health system and insights into today's pathway with it and what we want to do moving forward, their vision, and sharing that as well. And so this will also be an opportunity for our new regional liaisons to be with us out around the state and them getting to meet you and your constituents in your local community. So looking forward to these, and we'll be scheduling those in the fall.
All right, thank you. So shifting gears just a little bit, I wanted to give a high-level overview of Chapter 340 and the origins and evolution of Ohio's community-based system of care. So as you all are aware, Chapter 340 is the chapter in the revised code that governs the structure and responsibilities of Ohio's community-based alcohol, drug addiction, and mental health services boards.
So I'm gonna say Pat and Terry might add some color.
Yes.
So we would certainly welcome that if there's.
Yes, I know. This was my first time looking into this chapter. When previously to coming to the department, I worked for the Legislative Service Commission. So I've had the opportunity to at points to do little amendments to that law, but I never knew anything really about the history. So in preparing for this, it was really interesting, and I would love for others to jump in. So
and I'll also add, we wanted to have this on the agenda today because there's been so much great work done in the system, and the history and the foundation of where we've been are really important in us thinking about where we're headed. And so for many of you who've worked in the system for a long time, not just Terry and Pat, there might be other perspectives that need to be there too. And so, but it's helpful for all of us to be on the same page.
Thank you. So the origins of Chapter 340 go back really to around 1955, when Congress enacted what was known as the Mental Health Study Act. That act authorized the National Institute of Mental Health to study and make recommendations on mental health and illness in the United States. The act also created a Joint Commission on Mental Illness and Health. And then in the early 1960s, that commission issued a 10-volume report which assessed the national mental health conditions and resources. And the report actually commanded the attention of President John F. Kennedy at the time, who decided to establish a cabinet-level interagency committee to examine the recommendations and determine an appropriate federal response. So thereafter, in 1963, President Kennedy submitted a special message to Congress on mental health issues. And in that message, he said that he was, quote, proposing a new approach to mental illness that would have less reliance on the cold mercy of custodial isolation and would instead be supplanted by the open warmth of community concern and capability. So with this, Congress took notice and they were energized by this, and they thereafter passed the Mental Retardation Facilities and Community Mental Health Centers Construction Act, which was legislation that provided for community-based care as an alternative by giving states grants for the establishment of community mental health centers. And then 4 years later, in 1967, the Ohio General Assembly passed House Bill 648, which is the legislation that actually established Chapter 340 and created what were known as 648 boards after the House bill that enacted that legislation. And what those boards were is they were combined community mental health and mental retardation boards. Next slide. And then in 1980, the Ohio General Assembly passed Senate Bill 169. That act established separate community boards of mental health, known again as 169 boards after the legislation. And these boards were the precursors to the county boards of developmental disabilities. And then 648 boards then became known as Community Mental Health Board. In 1988, the Ohio General Assembly passed what has been called landmark legislation, known as the Ohio Mental Health Act of 1988. This legislation was really known as another step forward in moving toward community treatment rather than institutionalization, and emphasizing that local control rather than state control. One source that I found discussing this legislation said that it had the effect of increasing the involvement of recovering individuals and their families in the treatment process, enhancing training for mental health professionals, strengthening licensing requirements to ensure quality assurance, and putting into place case management as a piece of the community support system. In 1989, then, separate community mental health and addiction boards in all but the largest counties began expanding into single ADAM boards. This was also the year that the Ohio Department of Alcohol and Drug Addiction Services was established. And then in 2013, the Ohio Department of Mental Health and ODATIS merged to become the Ohio Department of Mental Health and Addiction Services. In 2017, the General Assembly passed, I got a pull ahead of myself. So the General Assembly actually, in 2007, attached community mental health and addiction service provisions to a large multi-component pharmacy bill, drug bill, known as Senate Bill 319. The mental health and addiction part of that bill required ADAM boards to make recovery supports available and perform related functions as part of the process of making mental health and addiction services available. And it also revised the community-based continuum of care that each ADAM board must establish. In 2019, then, the last county with separate community mental health and alcohol and drug addiction services boards, Lorain County, transitioned to a combined ADAM board. And that brings us to today, where the Ohio Department of Mental Health works in collaboration with a network of 50 ADAM boards and over 2,000 regulated providers. The boards themselves, as you're all aware, do not themselves provide services, but they contract with the providers to provide services in their local communities. Funding for these services are through the federal state dollars from Ohio MAS's budget, as well as local dollars that are often provided through community levies or other general operating funds. And now I will turn it over then to Director Chris to discuss the work group's first task.
Before we do that, Mary, Pat, anything I missed that we should have included in the history and overview?
I think there's something that may be interesting back in 2007 when you talked about the alcohol, drug, and that being put with the boards. The fact is, it wasn't. It was the mental health and drug boards. And it was determined at that time that if it was a drug, you had a mental health problem. If it was addiction or alcohol, you had a health problem. The health department continued to have the regional alcohol boards to provide care for alcoholism, and the mental health boards. And today, when you think of this, it's so ridiculous. But that was a group like this that came up with that decision. So let's keep that in mind.
Words of wisdom, Terry. Thank you. Anything else? Well, the first task that we want to talk about with this group is really helping us identify some sections in the chapter that the work group wants to focus on. And of course, we want to do this in a way that is efficient. And so we've developed a survey that we'll be distributing shortly after this meeting. And it has two purposes. The first, to help the work group identify those sections that need evaluation, and then to help prioritize which sections need the most discussion. And so everyone in the work group will get a chance to go section by section, provide some comment, and also rank which ones are most important. That's going to help us shape the agendas moving forward. There's 27 sections. And so with the meetings ahead, again, we want to be focused and make good use of everyone's time. We know some will have minimal or no concern, and others will have deeper concern. So the survey tool will be provided to all of you after this meeting. I want to also acknowledge that we do have letters, some with recommendations, some with more process oriented, both from the Board Association and the Ohio Council. And so this is an opportunity for everyone to weigh in writing so that we can grade the comments from those two letters with the survey results as well, and have that as a really strong foundation moving forward for the discussions that we're having.
Great. So I'm just going to take a moment now to kind of briefly go over what that survey entails. So the survey really has three components. What we did is we broke the chapter down into 8 sections. And I realized that a chapter could be broken down into probably, a number of different ways, but this was kind of the way we thought most logical for the purposes of this particular survey. So we will ask you in the survey to rank those groups in the order of priority to your organization or constituency. And then the second part, we're going to ask you to actually take a close look at each section in the chapter. Now there's 27 sections, so it's not a particularly long chapter. So, I mean, it's still a fair number of sections, but we hope that you will take the time to look at those and to indicate which of those are presenting challenges to your organization or constituency, and then also to briefly summarize those challenges, and if you can, to let us know which specific divisions within those sections are particularly problematic or causing challenges, and then to also specify a level of priority that you believe that section should be given when you consider the chapter as a whole. And then finally, the survey ends with a general comment section where you can add any other comments you would like, things that you weren't able to convey in the other parts of the survey. And then, so the next slide, these are the 8 groups that we came up with. I'm not going to read each of the sections that we assigned each group, but the first one is the ADAM board's organization and size. Group 2 is ADAM board powers and duties. Group 3, ADAM boards and residential facilities. And then group 4, continuum of care. Group 5, ADAM board budget. Group 6, vulnerable children. Group 7, opioids. And group 8 is kind of a miscellaneous group. And we do ask that you please fill out a survey and also submit it by, if you can, March 18th. That way that will give us then some time to really analyze it, take a look at it. And these surveys will be important for us in determining the agenda then for the April, May, and June meetings. And at this time then, I'd like to turn it back over to Director Chris.
Lisa. So I did introduce the members of our team here with us in the room today. We also have a number of team members joining us virtually as well, including our quality planning and research team, who is helping us really document conversations and will be helping us analyze that and look for themes as we go forward in the work as well. And that will be really helpful in providing that report out of this work group for next steps in moving forward. I want to, and the meetings are being recorded as well, so we'll be able to make sure that in addition to the note taking, that we'll have these to rely on to make sure that we capture everyone's input. But these surveys are a really great first step in making sure that everyone is able to help get the information that they need to us, and then we can use that for agendas. And so with that, I'd like to just open it up for discussion, questions. What's on your mind? In the space.
I'll open up with probably a pretty easy one. It's a weighty survey, it sounds like. Will we be able to log in and log back out? Or could we print it off so we could maybe organize our thoughts before we complete it?
So yes, we have set it up so that you do not have to complete it all in one sitting. So, and we also have the ability, once you complete the survey, to let us know that if you'd like a copy of your responses. Unfortunately, there isn't a way to print off, at the conclusion to print off the responses, but if you want to just email the 340 work group email, I can get that to you then. Yeah.
Thank you.
Thank you. Yeah.
Is it possible, just because it is hard to think through some things, we might want to talk to some other people, that we could get even just a Word version of the survey in advance so we can think about it? Because if you're coming in and out and can't print it, it might just be helpful to get a Word possible.
I think that is possible. Yeah, I will get in contact. Yeah, with our staff. Sure.
So I think we are prepared to send the link today. The Word version might come on Monday.
Okay, that's okay.
Is that Amy? I can't see.
Pressure.
Hi, I know that's a shot. I was expecting Amy to speak up before you.
When I think about the review of the legislation, even though it's been many dates there, I only really think about 2. I think about Kennedy, like community, there needs to be community mental health center throughout the country. And then when you think about the 1988, when you talked about the landmark list, I think about that as Ohio's commitment to deinstitutionalization And what does it take to burn people out? And so I'm happy to do the survey. My concern is that we are evaluating existing language and not taking into account things that were never conceived of when we did the language, the landmark legislation in 1980. Because I think we moved from deinstitutionalization in 1980 and work that to now saying, you know, we want people in recovery. You know, so I guess my question with the survey is that where you want comments? Or how do we get that, you know, or do we not want any landmark thinking in here about things that were never conceived of, that maybe should be conceived of as we move forward?
Sure. So I think those kinds of comments, we do want to hear about the things that were never conceived of, you know, when these statutes were enacted. So, and those would be good comments for you, general comment box at the end of the survey. So we've left that, we've designed that to be unlimited. So please, we invite you to give those kind of.
I almost think maybe we need a question, an open-ended question that is like serving people today and then thinking about serving people tomorrow. What's in the way or what's not there, so that we can kind of prompt that thinking instead of, you know, just having comment. Yeah, I still think we need a comment section, don't get me wrong, but I mean, to try and prompt that thinking about tomorrow.
Sure. Yeah, I mean, certainly I can talk with our staff member who helped in the design of this, and I can get a question to that effect added.
Yeah, and Prisha, we do want that, you call it landmark thinking. That's a good way to think about it. And I think if you go back to that slide earlier in the deck around not just going down the, you know, in the lane on the road that's already been paved for us, but thinking about, are there other creative or imaginative ways of moving forward in the system that hasn't been put on the table in the context of, you're right, today's version of a community-based system rather than the previous vision for deinstitutionalization. And institutionalization today isn't necessarily hospitalization. For many people it is, but thinking of jails and prisons as part of that too, and how we're moving to the community-based, growing that community-based opportunity and how that fits in. So appreciate that.
Director Petribi, I had a question. What's your sense of, there's current legislation in the House? And it seems to be if that effort's going down one track and we're going down another, I'd hate to get to May and there's things introduced and passed and, I'm trying to comment on existing that doesn't exist anymore. And any efforts to reach out or to try and put some kind of a in tandem effort on that in terms of going forward?
Absolutely. So we have already talked to Representative Swearingen, and we've had conversations with him over time, but most recently talked to him about that bill. This process was being designed when that bill was introduced, and we want to stay close with him in contact, and he appreciated that outreach. We let him know we'll keep him apprised of what's developing here as well, as he is also interested in having, he expressed that he wants to have interested party meetings and stakeholder review too. So we'll be staying in touch with him on that. This process isn't designed to react to that bill, but rather to think about, as Prisha said, what do we want this to look like to really promote who we want to be moving forward in the behavioral health system and how we can best accomplish that. What's in the way of that, what needs to be put in place to help us get there. And so we'll be working closely with him to keep him informed.
I think that's helpful, but at the same time, that means that we have to put a fair bit of energy into that process too. And just, there's no question that, I don't know the board association's direction on that, but at least as a kind of a freestanding single board, it means us needing to maintain lobbying efforts and other things because, again, it could have some impact on some of the issues we're discussing here. That's all. Thank you.
Yeah, absolutely. What other questions?
I just had one. You had mentioned earlier about 5119 and 5122 being looked at. And there's a lot of reference to 5119 in these rules or in this. Are we also going to be making comments about as it references, or I guess I'm looking for your process there.
Yeah, so I mean, just looking at 5119 as a whole would be a big undertaking at the same time we're doing 340. But there are sections of 340 that reference 5119. And so if we're discussing those, if those move to priority discussion level and how 5119 is written or the reference to it is important, then we would want to capture that.
Okay.
And make those recommendations. I think as we develop what the report will look like, there might need to just have a section on areas of 5119 specifically related to 340 that need looked at. That doesn't mean that's all that needs to be looked at in 5119.
Okay, thank you.
Director, a question. So sometimes it's content, and sometimes it's presentation. Well, is there a thought of maybe looking at the statutes of 340 and sections, and drafting them clearer and less paragraphs of information? Like traditionally in the past, you throw everything in a paragraph. They're hard to read, they're hard to follow. And I think by having them in that tend to increase rather than content. Comments like that would be helpful as well.
Absolutely. Yes. Yeah, absolutely. We want the statute to be usable in a way that helps promote prevention, recovery, treatment, mental health promotion for Ohioans of all ages, right? And we want it to be in a way that people can clearly interpret it and act on it without a great deal of confusion or conflict rolling forward. And so I think that's exactly the kind of comment. We're not intending to redline, to go line by line or redline the statute. It's more that thinking around this section is really confusing and these are the parts. But certainly we'll get to the point where perhaps we need to take an actual look at the statute and what would. We're not intending to do that with this work group though. We'll end up, that would be really laborious to do with a large group. This group is meant to identify challenges and put ideas on the table for how to overcome those challenges.
One thing I don't know document, and I don't know how this fits, but the challenge in all our projects are having to work. We come up with the best document. Sad there's no workers, so I don't know if that fits, or we could say, can there be reimbursement for college tuition if they work at it? I mean, are these things that in there, if that's something different, it's just a scenario. What we come up put out there.
Yeah. So,
Person in this room that will be.
right, exactly. I'll comment on the workforce thing in a second. But this is your meeting. This is your document, right? So if you want to comment on workforce and if there's an opportunity to think about how that should be connected to section 340, then put it on the table. I don't think anything's really out of bounds from that perspective. In terms of workforce, yes. We've got a work group working on workforce, and there will be some opportunity for more partnership with all of you and others in this work. So more to come on that in the coming weeks. But if 340 has an opportunity to impact that in a positive way, we're open to it.
And I think when you build out your plan, sometimes we have requirements and regulations that are part of 340 that go back well into our history, yet we have completely changed the way we operationalize practice. And so are there ways that we can look at those inefficiencies and redundancies? Because one of the things we hear from workers is the number one reason they leave is they're overwhelmed by the amount of paperwork and things that we ask them to collect in community behavioral health that they don't have to do in other settings. So I think, and that's just one example, but I think of where we're looking for efficiencies and, you know, I like the landmark kind of thinking of how do we do this differently? How do we think about what we do in whole person care that's person-centered and that we're treating people in a much different environment. We're not just treating their mental health condition or their substance use condition, really connecting them to a broader focus on health, wellness, and recovery. And so how do we update the language so that that's the focus?
And I agree 100%. I mean, for 25 years, I worked in a hotline and I just did it. Then when you come into all the paperwork and struggling, people became social workers and counselors to help people. So, I just don't have the answer.
But the survey lets you put the question and maybe someone else has the answer. That's what the whole process is for. It's collective wisdom. Good. What other information do you need to fully participate in the efforts here? Is there anything that you'd like us to bring forward to help support your success in this process?
I think it's important for us to know where we can't go. What guardrails are there, if there are any or not, because sometimes, you know, that will determine our level of input and feedback. I think that would be helpful.
To jump on what Janelle's saying, there are parts of probably had different drivers in it. And if there are reasons why those are, they're not going to change, right? Or there's conditions behind them. There's some of that background information. But there's more might be helpful. Yeah.
I mean, honestly, I'll have to think about how to do that because we're thinking of this as an idea generation process and not, and so I don't want to create artificial boundaries, but I understand like knowing that scope and what's on the playing field and what's not on the playing field. I'll have to think more. We'll have to think more about that. But if you have some examples of how we can help accomplish that.
Or could I ask the question a different way? Do you care if we present an idea that would potentially slaughter a sacred cow?
I think that's it. I mean, if that cow needs to be slaughtered, we should be talking about it, is how I feel about this process, right? And I say that, I mean, I know we're joking, but I say that with all respect. I really do think it's important to understand the history of how we got to today and how 340 got to where it is. And I think the point that that history may no longer be relevant today, but we also have to think about if we slaughter that cow, what are we undoing that's linked to that history that we do value today? And so I don't want to do any of that cavalierly, but I do think having those real meaningful conversations with this diverse group, with this experience and this history, and there's so many different perspectives in here, you know. Someone's going to say, wait, I need that cow, right? That's the hope, is that if everybody's truly collaborating and contributing and leading from wherever you are in the system, that someone's going to protect that part of the statute if it's meaningful, or help shape the recommendations around that, the thoughts around that in a way that doesn't undo a necessary part of our history too.
Well, and I think hand in hand with that, I really appreciated the historical context when you started this presentation. There are parts of statute we all kind of scratch our heads and think, where did that come from? Or what were they thinking when they did this? Because now it really doesn't apply to now. whatsoever. But that being said, many of us may take the same piece of statute and interpret it in 5 different ways. And so I think it's going to be helpful for us not only to talk about the sacred cow and whether it's a different cow or a different herd or whatever we're talking, if we want to go with an analogy, but also understand the reason for why we're looking at the same statement. We have 9 or 10 different ways that we look at it. Because I think that will help us in the conversation as we.
And I would just add to look at it from the perspective of what is it missing, or what are we missing, or who are we missing, as we identify, where the innovation could come from as well.
And considering the geography and culture of the various parts.
Yeah.
I come from where there are more cows than people, so. Cling to our cows. But, there are some things that I know would impact my communities in a much, much different way than others. And I'll say today that I probably won't be quiet about that.
We hope you're not. Tracy, I see your hands up.
Thank you. I didn't know if you guys could see me or not. One of the things that MAC will be looking at is language in this. I recall during time when I was serving in the legislature, one of the things that we often ran into was just antiquated language, language that was no longer acceptable, no longer really descriptive in terms of, how we talk about these subjects anymore. So that's something that we'll be looking at. And of course, from MAC's perspective, that cultural competence lens, that's what I always have to put on the table, and inclusiveness and who is being drawn into representation and service through the changes that we're making, and are we inadvertently excluding anyone? And last thing I want to say is just, from my perspective, there are no sacred cows. If there's anything that comes up during our conversation, it may or may not be relevant to the discussion right now for 340, may not fall into the context of that specific code. But if it's relevant to this conversation, if it's tangential in any way, I think we should put it on the table, because what might come out of it on the other side is it may not be something that we incorporate into this work group or this conversation, but it may raise some red flags or signals for other legislation that's not being discussed or put forward that can go down another avenue, through another representative and another work group altogether, if that's what's required. But I think anything that comes up within the context of this conversation is important. And we don't really often get these opportunities to impact the Ohio Revised Code. And when we're talking legislatively, I say put it all out there and we'll figure out what fits into this and what needs to become a whole nother product. Thank you.
Thank you. So I see there's some comments in the chat. I'll just read those out. Jeff, thanks. Great to have a survey that teases out what the main areas are that need addressed the most and in priority. It is a large group with limited time, and this survey is going to help us focus. So I appreciate that comment there. And then racial and ethnic equity must be part of this. Absolutely. And to build on Tracy's comments, Tracy, your experience as a legislator is so helpful in this space. So thank you for bringing that to it. Sometimes it's what's written, sometimes it's what's not written, right? And so when we say everything up for discussion, I really mean everything up for discussion. And there's no point in us doing this if we're holding something sacred that can't be talked about. So let's pay attention to what's not there as much as what is there that might need to be considered as well. Other thoughts?
I just want to kind of reiterate the point that Kay made about, one of the big issues is many times interpretation. And I think sometimes we also get caught in what I frame legend, legacy, and lore, that because the statute has been around for so long, we think it says something because historically, or once upon a time, we thought it meant this, and then we've changed words here or there. And so I think that's really important too, as we're doing this, to really, we will find times when we have to challenge our own beliefs because they're based on that legacy or that
legendary thought of how it was, or, you know, even some of it's thinking that is just lore, it's general thoughts that's not necessarily even part of what the construct was, but it's how it may have been interpreted in a specific place. So I just think that's really important as we're thinking through this as well. To the point of, you know, anything should be on the table around thinking about what do we need to move forward and how does that best help us provide services to people in our local communities.
You know, hand in hand with this and sitting and thinking about this, one of the things they hear a lot about statute is, well, it's inherent. Well, it doesn't say that. This is black and white. This is what it says. Oh, no, it's inherent. This is what this means. So again, it's the interpretation. And some of it has to do with context, some of it has to do with need, some of it has to do with just, I think some of it's the cultural pieces. So I think this is very aware of that, and just very patient with one another as we kind of follow through this.
I think some of that has to do with the fact that we're a home rule state, right? And so there's statute that applies to all of us, but every community is implementing the statute differently, or not always differently, right? And so that perspective of every community in the state is really important in that as well.
Now, I love the fact, I mean, this is old, right? This is, as we already decided. But what we have in the state right now, that I'm experiencing as a relative newbie here, is this new focus on person-centeredness and with Medicaid as well as loss. And I love that, and I love that what that also means is that the experience of people with substance use and mental health issues is respected and comes into play. And I'm sure that that is going to be a wonderful overlay, or maybe threading throughout, to have that kind of thinking, which is pretty relatively here throughout this process. I'm grateful for that.
Yeah, I'm just gonna react to that, Molly, and just, you know, because Harry and Pat are both on the meeting. When you think about the forward thinking in 1988 to require that individuals in recovery are on our board, that family members are on our board. I mean, you think about that many years ago, but that's been a thread of everything that we do from 1988. And I don't know if it was in there before 1988. You guys would have to tell me that, but I just think that's pretty amazing that I think that's why it was such a landmark thinking, is some of those things are as true today as they were then. Did the old 648 boards have to have people, family members and individuals in recovery on them from the very beginning?
Not before the Mental Health Act of '88. That's when that was put into the statute.
Well, good job.
Well, but I think what happened then, and I think this was symbolized by Terry Russell having a marching band come down through a association meeting, that the energy and effort that came through that act was that all of us were put in the same place of having to work for the client, and worked the state level, at the agency level, and the board level. All of our focus had to go there for a couple of reasons. Hopefully, number one was for the best for the client involved in the system, but financially and everything else, it was all tied together. And the impact of that was remarkable. So as we go forward on this, and I think, Laura, you've talked about it, let's hope we look at the same kind of a beginning on this, is that all of our focus needs to be on, why we're here and what we're trying to do. And if we can regain some of that, I think that would be helpful for us. I'm not going to preach on that, but I think that the legislation at that point really caused us to focus. And, Terry, you were an integral part of kind of bringing that about. And, I think it did have that impact for many, many years, and we've gone different roads since then. And maybe we need to capture some of that or recapture some of that in some fashion.
I appreciate that, Pat, but this is really for Lori. Pam Hyde created in 1986 Common Concerns, and your chairman of this group went over 340. I really think that going back and looking at Common Concerns, it was a group like this that met every other week for 2 years and talking about how we were going to change the state hospitals, bring everything into the community. It was the real document that created the Mental Health Act of '88. And I think looking at some of the goals, I've always said to you 1,000 times, it was promised we would have a community support system when we closed the hospitals. Well, the implementation just never followed through sometimes. So I think that'd be another thing you could go look at, dig out Common Concerns and see what they did and maybe bring back some of there are probably some neat things in there, or so out of dated things like me. I mean, things that nobody thinks about anymore. That would be funny for the group too. So something you may think about.
No, that's a great idea. Maybe you have a mimeographed copy in your office.
That was a good one. I owe you. Good one.
I do think he has the original copy in his office.
That deserves a mic drop.
No, we will find that. Thank you so much. I know that, I imagine the state library has it, and the archives at OU would have that as well.
Another thing about it, I'll be really. And this, I keep seeing alcohol. And drugs. That kind of.
So, as you think of this work ahead of us and the conversation we've already had, what do you hope, or how do you think that this work that we're doing will benefit Ohioans? What's your vision for that? What are your thoughts?
My hope, because we have so many stakeholders, that we'd be able to identify what's in the way, what's not working, or what are, again, those new thinking to advance what we need for the people. And, we live it and work it and read it because we're like, it's the statute about us, for us kind of thing. Like, you're all able to tell us, but it creates a problem, this part creates a problem, so on and so forth. And so I think there's so much value in hearing from all of the different constituents. Where are those crossroads, those hiccups, what gets in the way of, in our communities, we say, how do we get to yes? So what's in the way of us getting to yes?
I think we're the barriers. If we were a lot of money and they had to have 4 hospitalizations, no overspending, department, they said, how about 2 hospitalizations? Boom, we're serving people. So there's barriers, right? Sometimes you might not see it, but we want to get rid of the barriers.
Okay, people greater access to care. This is what I'd like to see Ohio with greater access to care. It's not so difficult. It's a lot of things.
I'm sorry. I'll just add to that because I think access is great, but utilization is better. And a lot of times we can't convert people from awareness and access to utilization because of some of the barriers that exist. particularly in underserved and marginalized communities. So how we even communicate that, you know, so what is our marketing or communication outreach and prevention plan? How is the language written so that it does create additional access or improved access, but also utilization, because that's the proof that what we do is working. And oftentimes in these rooms, that's not the rubber hitting the road. So I would like to see that there's equity there, that, you know, we have an emphasis on, you know, reviewing the language so that it does not miss anyone. And it takes that, you know, coming from a healthcare hospital, health system environment, you know, that patient-centered approach as we look at, and everybody's a patient, you know, race, ethnicity, color, gender, all of these things don't necessarily matter when you're talking about the patient, because they are a human. So we want to get to being able to make that equitable for everybody and improve outcomes for all.
I think one of my main goals is, you know, with workforce shortages that are going to continue to escalate as demands continue to escalate, is that we all develop a culture of partnership between boards and providers, and that we find a way to get people served first and foremost, and get the boards what they need from providers, and have boards ask what they need from providers, really just what they need, so that we can have that middle collaborative ground where we're, as a provider, we're not burdened with administrative tasks that take us away from the patient care. But as a board, they have to manage all these different pots of money, and they have to answer that. They need data. So what is a common ground that gets everybody's needs met? And then it sets a tone of collaboration for those we serve, and they see that.
You know, having been a part of similar processes in a former life, the one thing that I would hope that Iowans can expect as a result of this process is just that the plain meaning of the language of the statute be clear. So there are well-defined expectations created for the person whose wellness we're so concerned.
Along those lines, when I write policy for the organization, I always say that brand new employees should walk in the door, read this policy, and know what it means. And I think that is what we need to get to with this language, is that anyone served or a loved one of anyone served can read the language and understand what are the responsibilities of boards.
So you said families, so thinking of that question, what, I'm gonna start calling them people I haven't heard from yet. A number of you are directly connected to families or to people with lived experience, and so same question. How do you see the deep look and the genuine conversation about moving forward affecting families?
Lori, this is Terry. Representing those living with mental illness and the families, or 500,000 citizens of Ohio. We really look at the people in this room and the providers and the boards as our heroes. I mean, they really, we want them to do what they want to do. But we know everybody wants to do right. But for whatever reason, the accountability, and that's what I think families are talking about, is accountability. I think we should all be ashamed when one person goes to a prison or a jail or lives under a bridge because they don't want to, because they have an illness. And how did that happen? And then who was responsible, and how do we change it? Families really don't care about this meeting today, and those living with the illness, they don't know about it. They don't know about the workforce issue. They don't know about anything. All they know is they have a mean illness that needs addressed. So that's the other, probably my number one thing, is if we can try our best to keep this client focused. And sometimes we get into the meets and all at once we're arguing with each other. If we keep a client focused, we won't, because we're all here for the same reason. We're paid not for us, we're for the people who are all here to serve. So that's how I would from NAMI, that's what we feel.
Right, I see David Ross came to the rescue with some information about Pam Hyde and her her work around inpatient care, so thank you. That's in the chat, there's a link there. All right, any lingering thoughts? Anything you're afraid to say?
I just want to reiterate the point that Molly made about the stigmatizing language. If we are to gain the trust of those individuals we're serving, I think we fail to do that if we're continuing to use that same language that has kept them from availing themselves of services.
Yeah, and that's what, just as I've listened to the conversations today and really thought about that, again, continual shift and that ongoing shift of how do we shift from system to person-centered care and think about that we're not approaching the language in the way that, again, that it's the system or the board and this is what we do to people, but rather, you know, thinking about how to just keep that front of mind and centered. And I think the other piece I just am always struck by is the opportunity that we have not only today when we think about the people that we're serving, but also in the future, the people that we will be serving later and that, you know, potentially that could be any of us in this room or our family members or our neighbors or our loved ones to come. So I just really appreciate each of you being here. And I know that, you know, from the Recovery Ohio perspective, we try to be very, very person-centered and focus on all Ohioans. So I appreciate being part of the conversation and learning from all of you today.
Right. I don't feel like people are holding back, so that's good. But if you are, this is a good place to get it out. And if you're not going to do it today, put it on the survey. How's that? But I really do appreciate this group and the authenticity that you're bringing to that conversation. So I'm happy to open it to public comment. I know we've got a number of folks on the phone. If the group's ready to do that, we can open it up for any of those questions that may be coming in or folks that have thoughts to share.
Besides Mr. Ross, which you brought up, there was only one comment from a Dr. Martin who said, I would like to see language change of report from recovery housing may permit its residents to recovery housing must allow its residents to receive medicine for opiate reason here. Medicine works is allowing medicine and a patients have overdosed and died. The vast majority do not have treatment medication on their system. Thanks.
Okay. Well, I think if there's nothing else from the group, we can wrap early. We've got a little bit of homework to do before we can give you your homework. So, so we'll do that. We'll add the question that Precious suggested there with, and we'll make a Word document as well. And then anything else, any other actions that you were expecting that the team noted from today? Everybody has, you know, copies of 340 that will help you as you're looking at the survey. So that's a resource. If you think of any other resource that might be helpful to you in this process, certainly send that to the email box. Lisa's going to be monitoring that and we'll make that available, not just to you, but to everyone. You know, often one great thought is appreciated by many. So we'll be able to share that way as well. Again, the surveys we'd like back by March 18th so that we have time to look at the themes and really organize the next meeting, get those materials and out to you in advance so that you have time to prepare for the meeting itself. And the next meeting is Wednesday, April 6th. And it's not from 3 to 5 on a Friday. It is from 10 to noon. It will be here in Columbus and we're going to continue to work to have it in a place that's accessible and comfortable for everyone. So I thank you all very much. I hope you have a great weekend with some rest and renewal and safe travel home. For all of you on the line, I'll just do one more call. Anything else you wanted to add? Okay, let us know how the experience was and if there's anything that we can do better. I know that I will be bringing my laptop next time. And I think you'll be able to hear me better if I just follow the plan instead of striking out on my own and standing up. So we'll work on that for next time too, but we really appreciate you. All right, thanks everyone. Have a great weekend.
Thanks.
Alicia, thank you so much.
Yeah.
Multiple fronts there.